everybody. My name is Hosna Salmani. I'm a PhD student in Health Information Management in Iran University of Medical Sciences. It's my pleasure that I'm here to talk about digital health innovation in patient-centered care. I will go through the slides. What I want to talk about is a little bit definition of patient-centered care and goal, benefits, and technological advancement, and also the role of digital health in patients. Traditionally, nowadays everything is about data, but traditionally healthcare data is centered on clinician and institution, and nowadays we can shift to the patient-centered care, and that's enabling patients to interact with healthcare professionals and also can have involvement in their healthcare. At the end, we can have improved care and also greater engagement and increased satisfaction. So what is the patient-centered care? Everybody should know that patient-centered care is the treatment that focus on patient. But there is some definition that you can see in this slide, and the first one is an essential strategy to realize the goal of value-based care, and also a promise of better health care and increasing knowledge and skill of patient. And also, we should involve patient in decision-making. And also, it is an effort for example, patient, families, friends can join to achieve better health outcomes. So, why this shift is very important? It can allow us to, for example, have a better patient experience, and patients can have a better involvement in their healthcare, and after that, they can themselves see, for example, how will improve, and this can help them to satisfy about their care. And also, the next one is advocating population health. And as I told you, the value-based care is very important. And at the end, we can reduce the cost of treatment. In this slide is the road that we can, for example, involve patients. For the first one, we should inform patients. For example, if we have several clinical trial or research, we should, for example, inform them to register in our trial, and then after that, patients themselves engage in that, for example, treatment, and we should see what patient wants from the treatment. And at the end, it leads to empower patient, and patient should involve very well. So, can start digital health and patient-centered care. Digital health, as we know, can make healthcare more effective, more open, inclusive, and patient-centered. And also, stakeholders can, for example, create a network of digital health ecosystem. And at the end, we should, for example, focus on the patient. So e-health solutions are very essential to enhance quality of care, and also the patient can manage their health, and we can, for example, see the collaboration of patient very well. And we should, for example, adapting this solution to individual patients, and we should, for example, see the needs of patients, because personalized healthcare is very important, and our aim is patient-centered care. So, using digital health, devices can empower patients to learn about their diseases, especially in chronic diseases. For example, patients face a lot of problems, and they need to, for example, manage themselves very well. At the end, they can improve the quality of care. So creating a positive patient experience is very important, and it can also offered by a physician and at the, for example, primary care or the specialist care. And after that, we should, for example, have the minimal waiting time. And also, clinical quality and good outcome can easily be accessible through patient-centered care. So the goal of patient-centered care. We have two goals for patient-centered care, and for example, if we want to put patient-centered care in our system, it can also lead to improve the effectiveness and efficiency of healthcare. And also, we should, for example, empower patients and strengthen the opportunity for self-care, self-management, self-monitoring. And at the end, we can, for example, expect the patient participation. The benefits of patient-centered care. For example, what a patient needs through digital health. They want to build their own data resource, they want to learn about data, and they want to achieve the cost saving, and they want to improve timely access to care. They want to ask several questions about the treatment, and also the communication is very important for them to ask the question. So nowadays, research is continuing to develop a structural language model system standard, and also we should see the system in an effective and efficient care, and we should follow some steps to reach in this level. And also, why, for example, we need patient-centered care. What's the quest for quality of care? Because the quality of health is very important, and after patient-centered care, we can expect that we can reach in this level. At the first level, we need to encourage patients, need to encourage physicians to be with us to develop the new system that focus on patient-centered. And the communication with patients, with their language is very important in this regard. So if you want to create a patient-centric environment, the first one is set a criteria or benchmark or goal for our organization. Engagement of patient or physician start at the basic level. And we should figure out the need of patient, and we should, for example, reflect them to the physician to collaborate better and engage better. And at the fourth level, we expect that entrust patient to become a fellow traveler, and at the end, we can reshape and revise. In this slide, you can see several technological advancements. So everybody knows about the mobile health, that, for example, a patient can easily work with them for example, appointment, for seeing their laboratory result, test result, access to the healthcare, and also communicate and interact with the healthcare provider. And also, we have a telehealth. So telehealth, patient monitoring, and everything, when, for example, our focus be the patient-centric care, at the end, we can see the positive feedback from patient. And also patient portals, nowadays, several EHRs put the portal that patient can easily access to the care, and also at the end, we have a wearable technology that there are several devices and gear that people can use every time. I also wrote several articles related to patient-centered care. The first one is the impact of mobile health on cancer screening. So it was a systematic review, and the last one is related to a smartphone-based application for self-management of patients with colorectal cancer. And we developed an application for self-management, and patient can use very easily through them. And at the end, we got a higher score for the usability. Thank you so much for your attention. If you have any question, I'm here to answer to you. Thank you.